Good morning, everyone. I'd like to call this Board of Supervisor meeting to order. The date is January 11th, and the time is about 9:04 a.m. I would like to ask everyone to please stand. I'm going to ask our new Assistant Executive Officer, Tina Rocha, to lead us in the Pledge of Allegiance, and then please remain standing where Imam Ahmed Kayello from the Islamic Center Modesto will be leading us in prayer.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
In the name of God, the most gracious, the most merciful. Dear Lord, we ask you for your blessings for our city, our county, our state, and our country. We ask you for your guidance and to grant us tolerance and patience during these difficult times. O God, guide us to foster good working relationships where we can work together upon righteousness and piety and help one another avoid transgression. Please help us to live in security and peace with one another, and grant us success in our businesses and good health for our families. We pray to you, God, to fill our hearts with mercy, sympathy, and understanding for one another. We thank you, God, for our diversity. We thank you, God, for our strong community bonds and connections that we have in our city. We ask you, God, to fulfill the need for those who are in poverty and ease the suffering for those who are in pain. O God, we ask you to relieve us from the suffering and to make our journey in the new year a more blessed one. Make our intentions sincere and guide our speech and actions with your wisdom.
Imam, thank you very much for coming in. And I can't remember if we ever announced, but Tina Rocha is the new Assistant Executive Officer who took Raul Mendez's place when Raul is now the new CEO of Merced County, or CAO. So thank you again. So this is the first meeting of the year. This is when we change officers. Our chairman and vice chairman is not officers. And so today will be no different. Supervisor Terry Withrow was the vice chair last year. Typically, he moves into the chair, and then vice chair is chosen from the remaining. And so I'm going to go ahead and make the motion that Terry Withrow become the chairperson and that Supervisor Chance Condit become the vice chair for the 2022 year.
Second that motion.
So we have a motion and a second. All right. Let's do a roll call vote, if you're okay with that. I like this. It's official.
District 1 Supervisor Condit?
Aye.
District 3 Supervisor Terry Withrow?
Aye.
District 4 Supervisor Manning Grewal?
Aye.
And District 5 Supervisor Chance Condit?
Aye.
And Chairman Chiesa, District 2.
Aye. Thank you very much. So now we're going to switch seats.
Okay, thank you. All right, we're going to move on here. I think our first order of business here is going to recognize our past chair. And we've got the stuff to do here. I didn't grab the mic here. Okay, Supervisor Chiesa. Okay, here we go. All right. You ready? Yeah, come up here. What you're doing. Okay. So first of all, I've got a list of stuff that they like us to read that you've accomplished or what happened during your term. We had 31 regular meetings, 8 special board meetings. I think that's a record. I can't remember having more than 1 special board meeting during a year. So we had 8 of them that you had to oversee. The board approved 641 agenda items. You were as you know, the chairman in the second year of this COVID, as we've gone through all the COVID stuff, and you were chairman as we oversaw the redistricting, which is once every 10 years. So that was another, different thing that you had to deal with. So first, let me just give you this. This is the gavel for your chairmanship for the year. And I just want to thank you for it. Has been a rough year. It's been a different year, probably the most different year that even compared to last year when this whole thing first started in 2020. 2021 was just a really different year with the COVID stuff going on, and we had some different, for the first time in a while, some split votes, some difference of opinions, and some 5-0 votes that I know you worked hard to get. That we sat here and as we say, made salami in front of everybody a couple times, where we had to get to a spot where we all were happy with what we ended up with. And I know you had to work hard to do that. Those are not fun meetings to do, but it was just that kind of calm that you keep over the meetings that you're known for, that you're very well at. You've got the hot heads like me out there, but you keep things calm. You keep everybody in line, and we get through these things. So it was a tough year, and you did a great job of getting us through this. So, buddy, I appreciate all that you've done, and I always appreciate. I don't know if I'd do this job if you weren't around, and you're good for the county. So, thank you all you're doing, and I'm going to let you talk now. Just say something.
I don't have anything to say because you hear me every week, but again, it's always an honor and a privilege to serve as the chairman. We always say there's only, I think, 3 things you do as a chairman. You run the meetings, you do committee assignments, which is very, very important, and then you're the face of the organization for that year out in public. But again, the honor and the privilege is that the voters have decided that the 5 of us can make decisions, and we don't take it lightly. I want you to know that. We take it very seriously. And then the last thing I want to say is that chair right there that I just moved to, the only place I've ever sat, and this is my 14th year starting today, is in that chair or that chair, because I always set up the vice chair there so I can go back to my seat. I feel secure over there. It's like a, what do you call it? It's a weird deal that I have going. But thank you. I wish you the best. You're going to do a great job, and I don't know that I would do the job without you either, Terry. So
Thank you. All right, buddy. Good job. Okay, we will move on here. Okay, next up, we are going to have a presentation here from Jan Smith regarding Stanislaus County Law Library 2020-21 Annual Report. Jan, good morning. How are you?
Good morning. How are you?
Good.
I'm glad to be back, and glad to be back in person. My name is Jan Schmidt, and I am the director of the Stanislaus County Law Library. Thank you again for inviting me back to talk a little bit about what we do and what our mission is. As most of you know, the Law Library was established by the Board of Supervisors in 1893, not that any of you served then. But it was established in 1893, and since then we have operated to provide free access to legal information for Stanislaus County. We have a very small but dedicated staff that consists of a director and a full-time assistant. All of our other staffing, there is no other staffing at the present time. So our Board of Trustees, we are governed by a very dedicated Board of Trustees that I would love to share with you.
I did test it before, but we don't have
It's
to
okay.
email them.
All right, all right. Go ahead, next slide if you would. There we go, oops. So, one more. Our Board of Trustees is comprised of 4 Superior Court judges and 3 attorneys, including County Counsel, who serves at the will of the Chairman of the Board of Supervisors. They serve without compensation other than an occasional brownie, and they give very generously of their time and effort on our behalf. Go ahead, please. Next slide. Many people believe that the law library is just for attorneys. And while we do have a lot of resources that are geared toward attorneys and that attorneys and judges rely on, we also maintain a collection that is for self-represented individuals. As our mission statement indicates, we are here, we exist to help the public access the law. And more than 50% of our services are geared toward, and more than 50% of our patrons are actually unrepresented litigants who simply cannot afford an attorney. Please. Next slide. In that regard, the Law Library is doing a lot to help people from home. Our web presence is ever increasing. We're providing now more forms, self-help books. We offer a live chat service. We also staff Ask a Librarian, which comes from the state court website, so people who log into the Judicial Council website with questions get directed to a law librarian who can provide them with reference information. We provide attorneys and self-represented individuals access to immediately updated case law and codes through a program called FastCase, where they can get reliable, accurate information right from home or from their office. Next slide. During COVID-19, a lot of agencies, including ours, really had to rethink how we get our services out to people rather than getting people into us. And in that regard, we really did revamp our web presence to invest more in how we could deliver things to them. We obtained more legal databases that were accessible outside of our 4 walls. We linked up with several other law libraries to create some classes and how-to videos so that if people had to go to court and they'd never been to court, they could see how to present evidence and how to present themselves and where to stand. More so really than how to fill out a form, it was really about how do I actually go about getting my information in front of a judge. And again, we expanded our services in Ask a Librarian. Our physical collection is, our physical collection is quite robust, in spite of the fact that we're a small county. We do everything we can to provide coverage in every area of the law. We have seen a great deal of increased need for information in family law and domestic violence issues over the last 3 years, in probate, end-of-life planning, and and conservatorship. And now evictions and foreclosures have become a big deal again. And although the court has a self-help center for some of that information, it really doesn't address most of the need of the patrons that we see. And so our collection has expanded slightly, but really in areas that more address the public rather than attorney materials. Next slide. Law library funding is often misunderstood. For those of you who've been on the board for years, you know that we have struggled greatly since 2008 when the state took the court funding away from the county and distributed it themselves. People often think that we get part of the library tax or that we get general fund dollars from the state, and we don't. Law libraries are actually funded by $29 out of every filing fee. So every time someone files a civil lawsuit or a conservatorship, we get $29. And that's how our general operating revenue comes to the law library. Stanislaus County, and we are fortunate to have a partnership with our county, provides every service that the law allows the county to provide for us. And we are very grateful for that partnership because we could not provide the services we do without it. The Business and Professions Code provides our quarters and indicates that the county will give us a building, but Stanislaus County goes above and beyond, and they pay for our janitorial and some of our administrative services as well, and we appreciate that. Next slide. Yeah, there we go. As some of you, like I said, as some of you know, we had a 40% decline in filing fee revenue from 2008 to 2019, and that really kind of gutted the law libraries operating year to year. And that was just on the upturn when COVID-19 hit. And so Stanislaus County, along with 40 other county law libraries, engaged in a pretty strong lobbying campaign, and we started working with the legislature to kind of correct the underlying problem that makes our funding so unstable. And I've been here going on 10 years, and I've been the chair of the legislative committee for the state association for 10 years, and we finally received an allocation in 2018, and we received an emergency allocation during COVID to kind of stabilize our funding. We are still working and appreciate your support and your letters when we ask for them. A long-term solution to law library funding, because we can't continue to operate on $29 per filing fee. Go ahead. The allocation impacts, the chart that you see in front of you, the red funding is how much we received in 2018 and how much we received in 2021. We are very fortunate to have received a 2-year allocation in the last legislative session. So the large red bar from 2018 will be something akin to that will be received last year or this year and next year from the state legislature. And in the meantime, we're going to work hard to work with the state legislature to get some stable funding and some long-term funding. But more than that, we need to make sure that we do everything we can to impress upon new legislators how important access to justice is and what our role in that is. And in that regard, we appreciate your support very much. Go ahead. We are located, I'm sorry, this is the first year. This is an overall picture of our finances. And as you can see, our expenses are always more than our general revenue. So that's not a good model to operate on. And at the same time, because of the state funding, we've been able to maintain our fund balance for 2 years in a row, which is a huge jump for us. So go ahead. We're located at 1101 13th Street. You are welcome. Your constituents are welcome. If they come to you and they have an issue that they have to represent themselves in, please send them our way. We are here to help. And we do everything we can to serve them.
Very good, Jan. Thank you very much.
Thank you.
Any questions or comments for Jan? You know, I'm just going to say the same thing I say every year when you do this report, because it really did mean so much to me when it happened. When I first went out on my own, left the firm I was working for and started my own office, all I had was a desk, and it was in 1990. I think I was 30 years old at that point. And one of the things that an accountant, a CPA needs is we need a law library. We need the tax code in front of us. And because we constantly were referring to cases and regulations, and so I couldn't afford it. There was no way that I could go out. It was very expensive. At the time, it was the books, and it was all in the books, and the updates come constantly every day practically when you subscribe to one of these services, CCH or whatever it was at the time. And there was just no way that I could afford to do that. And so I would spend time at the law. It was, thank God, that the law library was there, and I'm sure you still do have the tax code there. And it allowed me to be able to go and do my research, for which I couldn't have afforded to do otherwise, until I got to the point a few years down the road where I actually could, subscribe to a service and pay for it. So I'm so thankful for the law library, and I know I'm just one little individual that used it, but I know so many attorneys the same way. You go out and start your own office, you just can't afford that service and to pay for it and to update it. And so it's just such a good thing to have in the community. People don't realize, not just for accountants or attorneys, but as you've illustrated here, just for the general public to go out and try to get information without having to go pay somebody to get that. So we so much appreciate all that you do in the library there, Jan. So thank you very much for your presentation today.
You're very welcome, and the book updates still come every day.
Yeah.
Thank
Very
you.
good. Thank you. Okay. Let's move on. I think our next up is we're going to have an update on the related to our 2019 novel coronavirus COVID-19 emergency essential services in Stanislaus County. And I think that Jody is going to kick it off here.
I will. Thank you very much, and let me be the first to say welcome, Chairman Withrow.
Thank you.
And welcome, members of the board, to 2022. Happy New Year to all of you and everyone here in the audience. Thank you so much for joining us. So I'm going to depart from my normal opening to provide some thoughts and context on where we are in this emergency response to COVID-19 as we enter this new year. We generally try to limit our editorial comments in these presentations, but I recognize that some of what I'm going to share this morning could certainly be viewed that way. In preparation for today's meeting, I went back to a year ago, and I watched our very first presentation on COVID from January of 2021, just to see where we were at a year ago. I think it was the first meetings for Supervisors Condit and Chance Condit, and it may have been Manny's maybe second or third meeting, I think, on the board. So it certainly seems like a lot has happened in your first year here on the board, and I want to recognize that you were new to joining us at that time. Last year's presentation at the beginning of the year was really focused on reopening schools, availability of testing, and the very first distribution of vaccines. At that time, we were peaking in what we recognized was a pretty deadly winter surge. We had about 3,100 cases and 60 deaths per week a year ago. Our hospitalizations were well below 100 in November of 2020, but had grown quickly to 360 in December of 2020 in just 1 month. And we had about 75 COVID patients in the ICU when we were here a year ago. Dr. V reported the first pediatric death in Stanislaus County, which was a young child with severe underlying disease. And while Dr. V tried to share some words of encouragement for all of us, she did summarize our situation in January of last year with one word: grim. So we've all watched over this last couple of weeks as COVID-19 cases have skyrocketed with the emergence of the Omicron variant in Stanislaus County. Every person I know has had some examples in their family of the impact of COVID infections in the last 2 weeks, mainly around whether you're going to school or not going to school, or can you go to work, and what can you do right now. And with that, we once again see our testing systems overwhelmed by demand. Schools are obviously struggling to maintain consistency in the delivery of in-person education, although they're all make that a number one goal for them. You see our schools in this county trying to remain open. They just need to have enough staff who are well enough to operate. I'll leave it to our team to provide you all with the latest data on impacts within our community, but it's safe to say that as we present this morning, that COVID is practically everywhere, and it's impacting most people in this community in some way. So entering 2022, it appears we're entering what I would characterize as a third phase of our response to COVID-19. And I characterize phase one as that time we spent from the initial onset of COVID to the wide distribution of vaccines. What was notable about that first period of time with this emergency was the absence of data that would normally be available to help drive any of our public policies at the local, state, or federal level. So we had some statistical models at the time, but as Dr. V would remind all of us, all models are wrong and some are helpful. Yes, we had studies emerging on how the virus spread, and we knew early on that young people fared much better. But for the most part, government appeared to be somewhat flying blind in respects to public policy in those very early days of COVID-19. Phase 2 brought us the hope of vaccine. One of the most encouraging days in my tenure of public service was at our former Scenic Hospital in January of 2021, so almost 1 year ago, to support those initial days of vaccinating or having the availability of vaccine for all individuals in our community 65 and over. We decided to skip the bureaucracy of scheduling appointments and set a goal to distribute every dose we had each week as they were in limited supply, and that strategy worked. Talking with people in line that day is a memory I will never forget. I recognized that the new expressions from those seniors of joy and hope, they were really a reflection of how much despair our seniors had endured throughout 2020. Personally, we were very encouraged in the months that followed that January. Our case rates diminished, and most restrictions in California were eliminated by last summer. This is the point where I acknowledge that what has occurred in the last 6 months represents a time that I would not have predicted after our early momentum with vaccines. The Delta variant emerged and presented our third surge of cases, which ultimately overtaxed the healthcare workforce at a time when many of us had expected COVID would remain on a downward trajectory. Phase 2 also brought us to a rapidly growing polarization of viewpoints on the relative risks of COVID and the implementation of vaccines as a solution. I'll have more to say on that later, but it's important to acknowledge the impact of our public divide as a backdrop to the spread of the Delta variant, as we experienced 411 COVID-related deaths in the last 6 months of 2021. We're still finalizing our numbers for the latter part of December, but it appears right now that of those 411 deaths, only 35 of them had taken steps to be fully vaccinated. The events over the last several weeks clearly indicate we have entered a new phase in our life with COVID-19. It may be that we are entering a new normal of this virus, or perhaps we are coming closer to what is referred to as an endemic, or what many say is learning to live with COVID. That may not prove true, but there's no question the dominance of the Omicron variant changes some of the basic principles we have operated with over these last 2 years. We recognize the new variants can emerge at any time, and those new variants may present substantial changes in how this virus behaves. This reality argues that our public policy should be ready for revision at any time. We also recognize the effectiveness of current or future vaccines and therapeutics will vary. Current vaccines and some therapeutics greatly reduce the severity of disease for most people. It is also true that the virus can outmaneuver our best science to continue to spread in the future. It is important to recognize that while phase 1 was defined by a lack of data, that is no longer true as we find ourselves 2 years into this COVID era. Data and research on the societal impact of COVID grows every day, and a quick Google search will give you whatever statistics you would like to support a wide variety of viewpoints on the terrible impact of COVID-19. So as we enter phase 3, we must ask ourselves what is most important to us at the local level as we reset our goals for this new year. With that, you can expect our team to revisit our primary objectives in this new era of Omicron and what variants may come next. You can expect hospitalizations will remain a primary objective driving our public health strategies in 2022. From the very beginning, we have orientated our goals around protecting the availability of our local hospitals to continue providing high-quality health care to everyone in our community. That will not change in this new year. What you can also expect us to talk more about this year is how to address what we perceive to be as gaps in the federal and state response to COVID. While much focus is placed in our country on prevention of infection, what is not discussed often at the federal and state level are the resources and infrastructure needed to address illness from post-infection to pre-hospitalization. I know this may sound like passing the buck to others, but the simple fact is that therapeutic drugs and treatment protocols are controlled almost entirely at the federal and state level, leaving us with limited influence over how to maximize their benefit at the local level. So our team will share some of the work that they've done over the last year to bring more consistency in treatment at the local level, but we acknowledge that this will remain a priority for us in 2022. I had mentioned in my prior update in December that our team was reviewing the ongoing need for a declared local emergency. There are two components to the emergency declarations ratified by the Board of Supervisors in 2020, which provide expanded authority in some instances for us to take unilateral actions deemed necessary to support our emergency response. So we're reviewing the technical needs for those actions going forward, and we recognize that it's been quite some time since it was necessary for us to take any unilateral actions due to the implementation of the robust systems and all of the staffing that has been added to address this emergency response. So we'll return to the board later this month to review some of the options and alternatives that we have on whether or not the emergency declarations need to stay in place or what changes we may recommend. Finally, I would like to recognize this growing divide of public opinion on COVID policies in our country, our state, and even here in Stanislaus County. It seems that most media reporting slants one direction or another when describing the current state of affairs on COVID-19. I start each day looking at our data dashboard on cases, hospitalizations, and deaths. About a week ago, I noted that our overall hospitalizations had increased from 84 to 119 over a 2-week period. And at the same time, our COVID patients in local ICUs went from 20 to 16. I learned long ago that you can't put too much faith in any one set of numbers, but we do monitor trends, and those two trends were going complete opposite directions within a short period of time. So that's just a curious development that would need to be watched over time to see if it's some form of an anomaly. But it also occurred to me on that day that media reporting of these statistics could say two very different things at the same time given these numbers. One report could say Stanislaus County hospitalizations jumped 42% over Christmas holidays, while another report could say ICU admissions went down 40%, and with the less severe Omicron variant. So it's very unfortunate that we find ourselves in this divided space where even pointing out that there are valid arguments on both sides of these issues puts you in line for what can be extreme criticism. Regardless of your viewpoints on COVID-19, I would encourage everyone to seek out balanced reporting on what is happening in our country as we enter yet another phase in our life with COVID-19, and to strive for greater understanding of opposing views where possible. Please know that your leadership team in Stanislaus County continues to seek a complete understanding of the data and the facts that drive our public health policies. And although we may form strong opinions over time, please know that those opinions are loosely held. The most essential learning lesson on COVID-19 is that this virus continues to evolve, and therefore we must evolve our strategies as needed to best serve this community. So thank you very much for listening to that. I don't do that very often, but I felt it was important for today, and I'll probably have some comments a little bit later, but I'm going to go ahead and turn it over to Dr. V and Mary Ann to share some of the data and statistics and actions that are important for us.
All right, good morning, everyone. Sorry. Good morning, Chairman Withrow, members of the board, Mr. Hayes and Mr. Bowes. Lovely to be here. Happy New Year. A new year and a new look for our presentations. I was going through old presentations as well, and had one template for 2020 and one template for 2021, so I thought it was time to update our look for our presentations. So this is the 2022 look, I hope. I thought I'd start with talking a little bit about what we know and don't know about Omicron. And as Mr. Hayes said, I've really tried to present, situation and guidance and keep my opinions out of it, but that's really not possible right now. So there's going to be a lot of my opinions in this presentation. So I will try to point them out when they're there, what's absolutely known and what I think is true. So I'm going to start out with what we learned about Omicron. I think the biggest thing we absolutely know for sure is that it has a growth advantage. It's clearly growing quickly. It's taking over other variants. It has an advantage in growth. Where does that growth advantage come from? Is it because the virus itself has increased transmissibility? I don't think that's known. It's possible. So it may be some function of the virus that makes it spread more easily, but what is absolutely for sure is that this virus exhibits a lot of immune evasion, and it allows it to infect more people and thereby go on to infect more people again. So a lot of this growth advantage may actually be due to the immune evasion and not anything about the transmissibility of the virus, but could be both. So this immune evasion is pretty strong. The primary vaccine series and what we know about previous infection appear to be giving very little protection against infection. We have some numbers for a primary vaccine series of Pfizer being about 30% protection against infection. One of the questions, do boosters give added protection against infection? Probably. That was definitely shown for Delta. Probably true for Omicron because we know boosters boost up your antibody levels, and higher antibody levels definitely protect against infection. But how long does this last? And I think that's a bigger question. Is it going to be for 3 months, for 4 months? Is it only going to be for 1 month? I have no idea. I don't think anybody knows. And that's a key question about how we move forward with recommendations for boosters. So more to come on how long those boosters will give protection against infection. What we do see absolutely is that the vaccines are still giving very good protection against severe disease. Hospitalization, which we struggle to track, but certainly deaths, we're still seeing very good protection by vaccination. Another part of the immune escape that we're seeing is 2 of the 3 monoclonal antibodies are no longer effective. So the BAM-EDI that we so fondly call, and the Regeneron are not effective against Omicron. So losing those 2 that are probably our biggest supply of monoclonal antibodies is a problem with Omicron. So is Omicron more severe? It's absolutely true that we see it being less severe on a population level. There are many people vaccinated or with previous infection who have some protection against severe disease, quite a bit, in fact. So it's definitely less severe when you see it go through a population. When we look at our numbers and then our hospitalizations, our ICU, and while deaths are a lagging indicator, and we haven't seen that increase yet, it most likely will, but probably not that much. Again, that's opinion. Do boosters give added protection against severe disease? Oh, I missed the middle one, sorry. Is Omicron less severe in someone who is really what we call immunologically naive, who hasn't been vaccinated, hasn't been previously infected? I don't think anyone knows. There are some hints, maybe. There's certainly some laboratory data that seems like, well, it replicates more in the upper respiratory than the lower, but that's not known for sure. There's certainly still people getting very sick with Omicron, so not quite clear. Do boosters give added protection against severe disease for those at risk? So definitely it was shown for Delta. When people were 50 and older given a booster, it did boost up their protection against certainly hospitalization. Probably for Omicron, but there are no data. Omicron's just too new to be able to follow that for any length of time and know that. But it probably does for those at risk for severe disease. There is also, finally, a shorter incubation period for Omicron. The incubation period is the timer from you're exposed or infected until you become symptomatic. And it was quite long in the beginning. The original virus was 5 days incubation on average. It got a little shorter for Delta at 4, and now it appears to be only about 3 for Omicron. So really shortening that time between infection and when then you pass it on to other people being most key. So having talked about what we know and don't know and think about Omicron, I was going to go into our surveillance numbers. They're quite remarkable what we've seen. So you can see here since pretty much the beginning of the pandemic, our 3 waves and now our 4th one, as you can see our case counts, having reported over 2,700 yesterday, are really quite high and have already well overtaken our late summer, early fall surge that we saw. This is also in addition to not having reporting of any home tests, right? So those don't get reported to us, which is fine. So you can see a pretty large increase in cases that we've already seen. Here's our case rate. It's the same thing. You can just see the numbers. It's a 7-day average, smoothed out a little bit, case rate. And you can see, just like if you remember when I came last time, I showed South Africa, it's pretty much the straight line up in looking at cases. Our percent positive in testing, which is a good indicator, is the highest we've seen. We're at least 17% now of PCR tests. So a good number of positive tests coming back at this time. And then as we look at our hospitalization and ICU, you can see the increase in hospitalization. We were up to 166 yesterday, but the ICU has pretty much stayed rock steady. You can see it down there. It's running around 17, 18, 19 in the county. So we're seeing still that disconnect, and we'll continue to watch it as we move through this surge. And then putting up our epi curve for deaths, you can see our small peak. It really mirrors cases. It just is a little bit delayed, usually by a week or two. We haven't seen any increase in cases, and we will continue to get some deaths reported for December. It's still pretty early to have those finalized out. So I wanted to talk a little bit about our wastewater surveillance, which, you know, the case surveillance is some people test, some people don't. You get some reports of the test, you don't, so it's not a consistent. But wastewater surveillance is actually very good. So wastewater surveillance has been used for other diseases like polio to watch for it. Polio has been relatively eliminated from most countries in the world. And there are many countries who do a lot of surveillance to look for it, and wastewater is a pretty quick and easy way to do that on a large population basis. So we got some wastewater surveillance. This is a project with Stanford and the University of California system. It started in first Modesto in October, and Turlock has been added in December, but we don't have those data yet. They go through a pilot project, and then we'll ramp up and get some public reporting. So I'm going to show you what we're seeing, at least with Modesto so far. So this is the graph that we get, and we get one every Monday. And so this is the one, well, I actually downloaded it from the website on Sunday. The web address is down there. It's a publicly open site, so anybody can go there and play around with the different reports. I'm only bringing 2 forward, but anyone can go and see these graphs of wastewater surveillance. So you can see what you're seeing, the N gene, the S gene, so the N and the S on those 2 top curves over time. And then the dark blue one that has the deletion in 143, 145, which is the in the N gene, that's Omicron. So we used to have a Delta in there. When Omicron changed, they switched out the Delta test for, which tracked along with the N and S, because what we had was Delta. And we're watching Omicron there on that dark blue line. So right now we're estimating that Omicron is about 56% of all the detected SARS-CoV-2 viruses, the virus that causes COVID-19. So this is a great way to have some pretty good population level surveillance. It doesn't lag as much as testing and getting test reports, so it's a bit more timely, and we really like watching this because it's very good. So we can also, on that site, they'll show you comparing to a bunch of other cities where they have the data up there, and UC Davis, so a university. And the dark purple line that's bold, I've highlighted that in here. So what you can see is with the many other cities, and you can go to the website and click on the different cities and then see what they're doing. But us in Merced in the red, we lagged, and UC Davis, we lagged behind other cities that are primarily in the Bay Area by a week, week and a half, not quite 2 weeks, with Omicron increasing. This is the Omicron graph. So really seeing in the wastewater what we've absolutely seen going on in around California, in the Bay Area, looking at their surveillance and then looking at ours. So it's really tracked quite well, and one of the reasons we're really watching this is to keep track of what our proportion of Omicron is, because we're still using those 2 monoclonal antibodies. When it gets up to 80%, we will lose those 2 monoclonal antibodies, and then I'm going to tell you what we'll have available then. But as 2 large volumes, they're still helping about half the people right now. We're keeping them going for now. So, and the 80%, by the way, isn't my number. It was made by HHS, Federal Health and Human Services, who distribute those. I was going to go on to guidance change. So based on this Omicron, it's kind of turned everything around. And so, you know, we kind of talk about how it feels like the beginning of the pandemic where, you know, we're talking about testing and shortages and what PPE to wear, and then the guidance is changing like every 5 minutes. So have some patience trying to catch up the guidance with what Omicron is doing with transmission. So here's some updated CDPH guidance, isolation and quarantine. I think everyone has heard about it. I put it in here. for all of us to see. Isolation is for a person who tests positive. It's 5 days, and if the symptoms are improving, like if you have loss of taste and smell, that doesn't tend to go away in 5 days. Coughs can linger, so they have to be improving, and you can't have fever, and a negative test then can exit isolation with masking to complete the 10 days. CDC did modeling. CDC has the same recommendation, but without a testing strategy. CDPH has put in the negative test as a recommendation. So the modeling by CDC is 31% are still infectious, but their model, as I've heard, doesn't take into account vaccination or previous infection. We do know from studies that people who are vaccinated tend to clear the virus much quicker, so it would be less than 31%, certainly for vaccinated. Probably previous infection has some decrease as well. So, and then just quick review quarantine as well. Those are for people who are exposed but not yet test positive. It's 5 days, and if no symptoms and a negative test, can exit isolation with masking to complete 10 days. The problem with these guidances are the availability of tests is not, we just don't have them available right now. So we need to take this guidance and follow it to the best that we can, but without tests available, I would continue to follow CDC guidance and try to use these without a testing strategy, because it's the only way we can do it practically and on the ground. And you know, Kayello is going to have their own rules. School guidance will come out with school guidance rules, but that is the recommendation for the community because we just don't have access to testing right now. School guidance is pending. We're trying to help the schools get through this time of many cases and work through the fact that contact tracing is no longer doable with a volume of cases and moving them to more of a continued masking as per the state public health officer order, and just trying to keep the kids in school and the transmission as low as we can. I'm going to go into briefly the COVID-19 treatments. So there are more coming. So for the outpatient treatments, I talked about most of these last time. These are for Omicron and for those at high risk for severe disease. We have antivirals. There's 2 oral ones that we talked about last time, the molnupiravir and the Paxlovid. Then there's IV remdesivir, which is now has data of outpatient use. And the monoclonal antibody we have is sotrovimab. And then I get some questions about fluvoxamine and a large study that was done, so I put this on here with a question mark. There was a large study in Brazil that was published in late October, early November. What they found, looking at their intention to treat study, was no statistically significant difference in hospitalizations versus placebo, in hospitalizations, in duration of hospitalization, in death, and in viral clearance. There was a tendency towards doing better with fluvoxamine, but it did not reach statistical significance. So I put it on there. You know, there's no recommendation for or against it. It's a possibility. It has some early data. What I think is most important as you look at all of these that have various side effects and various indications that we're going to talk about on the next slide, talk to your healthcare provider to see if you qualify for the treatments first, because they're for people at high risk for severe disease, and then which one is best for you, because there's getting to be more and more choices. So what is the availability in Stanislaus County? The molnupiravir, as you can see from the studies, and this is how the studies were done, not how they're licensed or approved. Prevention of severe disease in those at high risk, 30% within 5 days for molnupiravir. Paxlovid was 88% within 5 days, given within 5 days of symptom onset, as in. There's our allocations that we got. Molnupiravir and Paxlovid, our first allocations were on December 23. They arrived in pharmacies the week between Christmas and New Year, so we've been told. And then we just last night got a second allocation that's about the same. It's 20 less of the molnupiravir. So we don't have any allocation interval on that. They still have not said if this is going to be, it's roughly every 2 weeks, a little earlier than that, or if it's going to go down to weekly, or I don't know. We've gotten no indication. The state, I don't think, has any indication from the federal government either. Remdesivir has a new study called Pine Tree. I don't know why that sticks in my head. That showed, as an outpatient, these are all outpatient, 87% prevention of severe disease when given within 7 days of symptom onset. That's the study. This is IV. It is 3 days infusion, so you'd have to get an infusion each day for 3 days in a row. So not as easy to do as an outpatient. This is not allocated, it's commercially available, and providers can order it commercially. So Trovimab, the study was 85% effective at preventing severe disease when given within 5 days of symptom onset. We were given 60 courses 2 weeks ago. We just got our allocation last night again, and it's 54, but they said they've gone up to weekly. So not sure how that's going to continue to be allocated, if we'll continue to get 54 a week, but that's it for the county. Fluvoxamine is commercially available. It's a generic drug that's used to treat OCD, so it's widely available. I think that's all I wanted to say on this slide. And I'm going to turn it over to Mary Ann to talk a little bit more about availability in the county.
Okay, before I do that, I just want to make one comment on what Dr. V shared too, in terms of the 2 oral antivirals are being told that it's gone out to pharmacies. It's not in all pharmacies because, as you can see, the supply is so limited. They've started with 5 pharmacies, and the physicians all know where those pharmacies are to send patients to. And I would assume that as supply grows, there'll be more access points, but just so you know, it's limited. I know there's a lot on this slide. A lot of what's on the slide we have covered before, but in terms of talking about what has been done with regard to access for monoclonal antibody treatment, you all know that we had done a lot of work in trying to encourage many healthcare providers in the community to become monoclonal antibody treatment locations. We had many. Some take care of just their patients. Some are open to all. Some of the hospitals were also providing. Multiple were most all of them were ordering through us as a part of the state Mohawk process. We learned that Golden Valley Health Centers began also providing, and that wasn't ordered through us. I think a part of what's really important is what Dr. V covered, that right now we have both Delta and Omicron circulating. So the 2 monoclonal antibody treatments that have been available are still available in those sites while supplies last, for those patients eligible. But we're really nearing that point. As Dr. V shared with the wastewater surveillance, we know that Omicron is likely soon to overtake Delta, and so we're going to be for some period of time at a point where I've reported before, the allocation the demand hasn't exceeded. Well, we're going to be at a point, I believe, where the demand is going to exceed the available supply for some unknown period of time. The Trovimab that is showing effectiveness against Omicron, as Dr. V shared, we have had a small supply come into our community. That supply has been distributed between Kaiser and Elite Urgent Care, so all those others earlier in the slide don't have the treatment that is effective against Omicron. As the supply increases, we would have every intention of trying to restore the wider access, and depending upon how circumstances go, we'll continue to work to do that. But just know that for some period of time, that's going to be a bit of a challenge. The other thing that we talked about Elite Urgent Care. We have some county clinic space within that same building that Elite Urgent Care has. We've made available some of that space so that there's overflow, so that we could, Dr. Bassi with Elite could move more patients through, provided there's enough treatment supply. We've worked with payer organizations to make sure that there wasn't going to be a barrier there. And then, we talked about, but there's still folks going into the hospital, and you're saying there's access. So, the issue wasn't that we necessarily needed more access. Maybe it was more communication. So we've been doing that. We added to our case investigation script, there are treatments available. Please be sure to contact your provider. We provide information if they call in our call center. We've put out health alerts to all of the medical community. With the increased information about the oral antivirals, we wanted to get that communicated out to the medical provider community as well. So you can see we've sent out 2 different health alerts, kind of a public health process for any kind of public health information to the medical community. Dr. V also worked through the chief medical officers at the hospitals, thinking, okay, how about also sending it out through the medical staff offices, just as another way to try to get information in front of all the physicians so that they are aware. So we'll continue to do that. I think just know that for the unknown foreseeable future, the issue is going to be supply of the actual treatment. Okay. Okay, so let's talk about testing. With the significant rapid rise of spread, probably all of you, I know I'm getting questions about testing availability as well. This is right from our website where you can go online. You can make appointments. It links you right to the appointment systems. You can also go online at some of the pharmacies are still also registering by appointment for tests as well. The testing locations that those OptumServe is kind of a partnering that we've done with the state's vendor, and they've been working to expand capacity at those locations, whether it's increased hours or days or just more capacity during those times. What I would encourage the public, as you go online and you try to make an appointment, you'll see it may be a day or 2 or 3 out. Each of those locations will take some walk-in. It's just limited, it kind of depends on how many no-shows and what that supply is for that day and their capacity. So I can't guarantee same day walk-in, but know that they do try to accommodate what they can each day. Let's go to the next. Okay, so rapid at-home tests. The state has a project really trying to get a lot of at-home tests into the community. There's not enough. I mean, I'm getting phone calls, emails. Where can I get them? I can't find them. There's not enough. So the state did some distributing directly to CBOs. We tried to coordinate so that we weren't duplicating effort and making sure that we were trying to get the supply out as widely as possible. The state also distributed through the County Office of Education. That distribution, the volume was aimed at least a box. A box has 2 tests for every child in the school. SCO was working to get those out to all the public schools and the charter schools. The allocation that came then directly to the local health jurisdictions, to us, we worked to get those out to the libraries, through cities, because SCO wasn't working with the private schools. We reached out to the private schools. Any of those that were interested, we were distributing to those schools. And then through various programs, CSA, BHRS, Aging and Veterans, WIC, for those clients, just trying to find different ways to get the tests out in the community. The Family Resource Centers, they go as quickly as they get delivered in almost every instance. So at this point, we don't know when we're going to get another allocation that is meant to be for the general public. But as soon as we have more to distribute, we'll continue to try to get those out to the public. Okay, and then this is a picture of our website. Encourage folks, if you have questions, to go to our website. Lots of information there. Also, our phone number. If you have questions, please call our call center. There's a lot of questions. There's a lot going on right now. We're getting a lot of calls from schools, a lot of calls from businesses, because there's a lot of absences right now. And we're doing our best to keep up and to try to offer what information we can. In some cases, when it's business, it's A lot of that has to do with Kayello. Like Dr. V said, the test supply is limited. We don't have the ability to change what Kayello requirements are, so we're going to do our best to direct inquirers to the best information available at this point. Okay, and we've mentioned this before too, and as Mr. Hayes said, in terms of the phase that we're going into, it's always important, and we want to continue to to encourage the public, be your best self in terms of your own habits to maintain your best health. That's going to give you hopefully an advantage into the future. So it's never too late to try to gain some new, better, healthy habits for yourself. Okay, and then vaccination is still important at this point. We certainly will encourage those that are at high risk. If you haven't been vaccinated or you haven't been boosted, please go online and schedule an appointment to get that vaccine. And at that, we'll turn it back to Dr. Wishampayan.
All right, so 2022, I was asked to make some predictions about how we'll move through this year. So I'm going to do my best here to try to talk about what we expect to see, and much of this is opinion. So I believe absolutely with all my heart we'll transition from pandemic to endemic. This virus isn't going away, and we are luckily, that's probably a bad word, but I think Omicron has made it a bit easier for us to start living with it much better. And watch it as an endemic virus like flu, like RSV, like parainfluenza. There's so many of them. Our population really is no longer immunologically naive. We have some exposure to this. It's got to be over 90% at this time. The vast majority have some protection against severe disease, which has been our number one priority, is keeping our hospitals from being overrun with many people with severe disease. Those who wish to protect themselves and/or their children, with the exception of 0 to 4-year-old children, with vaccination against severe disease, have had that opportunity. That's one of the things we talk about with schools. The 5 to 11-year-olds have now had the opportunity to get vaccinated. One of the things that we need to do is, so I think all those support moving forward and learning to live with this virus more. We need to transition all the diagnosis and treatment to the healthcare system and out of public health. So soon it won't be mass testing sites. Everybody will be going to their doctor if they want to get tested, or hopefully Quest Diagnostics. The doctor puts the order in, the healthcare provider, and you just go down to Quest and get whatever done you need to do, like you do for all your other diseases. We will continue to focus on maintaining critical infrastructure, thinking fire, EMS, healthcare, education as the focus for public health. And then really continue to assist our businesses, our schools, our hospitals, our whole community, as we really do for all other communicable diseases. I have to say, in the last couple months, we've had lots of communicable diseases. We've had, I never saw the testing on that, but suspected botulism, where we got botulinum antitoxin. We've had Legionella. We've had hepatitis A acute, which we haven't seen for a while, many years actually. Salmonella, we have E. coli that's sugar toxin producing, so can cause hemolytic uremic syndrome. That's just all in the last couple months, and we continue to help anyone who needs our help in responding to these infectious diseases, and we will continue to do so. So it's not a big prediction for the year, but it's the best I could put together for now with all the unknowns in January. So thank you very much, and we'll.
Okay, thank you guys very much. Any questions or comments for Marianne or Julie?
One quick question on the, we received an email with someone saying the Pfizer booster was not available. Is that the case?
No, and we have, there's someone on our staff is reaching out to that individual too to try to help schedule. I can't say that at every location where vaccine is given that they have Pfizer, but I know we do at ours, so we're going to make sure that we can help them get scheduled for their Pfizer boosters.
Perfect, thank you.
Okay, any other questions?
Yeah,
Buck, go ahead.
Yeah, Marianne, Dr. V, thank you for your report. Do you want to take any guess of when Omicron might peak here in Stanislaus County?
Well, Mr. Hayes gave my favorite saying about modeling. So we have modeling. They're all wrong. But mid-January is the prediction for California. So we are lagging about, a week behind the big population areas, Southern California, the Bay Area, that are leading the surge. And, they're the big population areas, so they kind of, count. They're the ones driving that peak. So it's going to be, I would say, in the next week to two, if it matches what other places have seen. And that's what the modeling shows.
Okay. And
I'm
as
not
far as-
comfortable with that prediction, though.
Okay. As far as hospitalizations, obviously our number has gone up. How many, do we have data that shows how many were actually admitted for COVID and actually how many
No.
went and
No.
then tested positive?
No, we never
Is there
do.
a-
Yep.
We don't have that information?
Nope.
Okay.
Okay.
Although, can I just say, though, we've heard a little bit from the state, and I'm sure you're hearing it in the media, too, that a high percentage, maybe half in some cases. We don't have local data. We can't tell you of ours. It's retrospective, or it's other, a project where they're going in individually and getting that data to run a study on it. We don't have that information. So in some cases, those hospital numbers are probably not for treatment of COVID. It still, though, it's not exactly the same impact, but it still has some impact on resources, on hospital capacity. So it's still an important number, but just so everyone knows, it doesn't necessarily mean that number is in the hospital for treatment of COVID.
Okay. And I had a constituent email me about the COVID newsletter that goes out. Is it daily or weekly?
It has been weekly, but we're changing that.
Okay. They were just requesting more information on the monoclonal antibodies and where to go if that could be possible. At least put into the newsletter.
Yeah.
And it may have been, and they maybe have missed it, but if we could just double up on that effort. I know it looks like you guys are doing an amazing job in getting that information out in other areas. Maybe that was just a spot that was missed.
We've noticed that the newsletter, it doesn't have a large reach, and the clicks are going down. So we've been questioning whether that's really the best way of communicating. Maybe more on our website. It's just changing so quickly. So we'll figure out how best to get that information out. We don't want to put bad information out that's changing,
Okay.
but we'll see what we can do as far as how we can communicate that better.
I appreciate that. Thank you.
Manny.
All right, Mary Ann, Dr. V, thank you for the update. I know it's been a while since we've had one. And I'd like to start off by thanking CEO Hayes. I think those comments that you gave at the beginning were very fitting and very much needed, not just for us as a board, but for the public, because this is becoming tiring. This is becoming tiring for us, for all of you, for the kids. I can only speak on my behalf. I have 4 children, and my son was supposed to play basketball yesterday, but somebody tested on his, came into contact, didn't even test positive. So it was a game time decision whether we're playing or not, but that's small potatoes. There's other things, people's health's being affected. And the part that's really disturbing is it's pitting everyone against each other. If you wear a mask, you're compliant. If you're not, and I've always been one of that, mandates and choice play a big role in this. But also we have to be very understanding of the people that have gone through this. Obviously, people are dying from it, and people are affected on a daily basis. With that, since it is now, and again, this is kind of crystal ball questions, but you are our first line of defense, and you're the one that gets the information more readily from CDC, from the state and federal. Since it is becoming an endemic, and I've heard that term in the medical community really coming up, that this is something that we're just going to be living with, and as we get more immunologically naive to it, and people are either, some are saying even the Omicron variant has been help because it can lead to some type of long-term immunity. When do you think the mandates from the state get lax? Because right now it seems like the 5-day rule, obviously that's gone down from the 10-day. And employers are seeing this because, once a person is tested positive or comes in contact, it just kind of starts a domino effect on the employees, because then, some have to go get tested, some unfortunately use it as an excuse to just not come into work. And that's affecting, employers, and that's what I'm hearing from the business community. So do you see that, since this is becoming something that's going to be here for a while, that the restrictions get laxed as far as transferability, and what steps need to be taken to, make sure that we can still go on with our lives?
Yeah, that's a really hard question, because I have not been very good at predicting CDPH guidance and rules and timing. So my personal opinion, so if I can get away from predicting what they're doing and just talk about what I think.
And a lot of that is
okay.
personal. Like I said, I respect your judgment and respect the information that you receive. So a lot of this is editorial, just like the CEO said, but it's hearing it from multiple people and then coming up with kind of a analysis on your own. Yeah, so I think this surge, I hate to call it a good thing, really. It might turn out to be that, but hindsight's always 20/20, and we can look back at anything and see that it worked really well. So as we're looking at it going into it, I think we still approach it cautiously, because there are still people who are going to get hospitalized, severe disease, and there are still people who are going to die. But I think after this surge is over, I see this as hopefully the last fling for the virus, as we want to say. And then hopefully we'll see a good disconnect between the severe disease and the case rate, and we can stop a lot of what we're doing. I mean, I don't pay that much attention to case counts, except when it comes through as 2,702 or whatever it was yesterday, which is bad. But in general, I just want to watch trends, because the cases are going to continue going on. I think Omicron has showed us that. So really what I'm really looking for is that disconnect with severe disease, and we can really look at ICU. And once we start seeing that and learn more about how this acts with vaccination, with previous infection, and really get some comfort in it, I think we start going back to very normal daily life. It's going to take a little time, I think, to still get this information. We keep getting burned. I'm hoping another variant doesn't come out that's, does something. But as long as it stays that disconnect with the severe disease and turns it into what we think of as the common cold, more like, then we don't have to do a lot of measures to respond. Right? It's okay. We can just move on with our lives. Does that kind of make sense? No, absolutely. I mean, this has been an ongoing, you see the light at the end of the tunnel, and then it disappears rather quickly. But now that we know, you come to the realization that there might not be any light, then you just have to accustom, yourself in a certain manner. And that's, I think, the next step now, because, I mean, this has been going on now for 3 years now. It's when can we get to something of a normalcy, knowing that this is here to stay, and still be very, cognizant that it's going to affect people in different ways and different things. But I really like today's presentation to kind of talk about the other types of treatment that is available for people that are severely affected by this, and then lifestyle changes. If a lifestyle changes allows for us to get more immunity and allows us for us to live in more normalcy, I think that's a step in the right direction. But again, sorry to put you on the spot for something like that, but this is our opportunity. I know you make yourself very available to answer questions when we have some, but this is an opportunity for us to ask the questions in front of the public to kind of let them know what you're hearing. So I appreciate it, and as always, thank you so much for everything you do. I know it's a day by day, hour by hour sometimes, but you doing what you're doing, we really appreciate it. Thank you.
Thanks, man. Okay. Just to kind of wind this up, thank you guys for your presentation. Thank you, Jody, for your words. This has been very frustrating for all of us, and I love you guys, love both of you, but it's gotten very frustrating, over the last 6 months in particular, for me and other people on the board here, I know, and in no way, again, we love you, we love all the work you're doing. It's been hard for all of us trying to get through this and figure out. I very much appreciate how this has evolved into the our conversations about treatment. This is the second time we've really had a presentation about treatment, and I just think that's so critical to where we are right now. And I know we didn't have all this information, you know, for the first year for sure, but as it came, and a lot of it's not your fault, not anybody's fault, but a little frustrating when I look at the graph here that talks about treatment availability in the county, and we look at the percentages as far as the prevention of severe disease and how high it is for the Paxlovid, or I'm not saying these right, remdesivir and sotrovimab, you know, how high of a reduction in severity, and basically we're talking about saving lives, right, and keeping people out of hospitals and saving lives, and how little of those treatments we have right now. I can't fathom why we don't have more of those treatments, and this has nothing to do with you guys, I get it, or anybody in this room, but it just, you know, I know it's been all about the vaccinations, and which is great, and get everybody vaccinated, and we'll get past this. But as we see now, vaccinations, people still are getting it, and so treatment seems to be what we've really got to push. And here we are without treatments. I mean, we see what works, but we don't have the availability of it. I know that's coming from the federal level, but it's very frustrating that that's not here, because we're talking about saving lives at this point and saving family members, and thing that we've all wanted to do over the years as we've been fighting through this thing. So I very much appreciate you guys getting this information out there and talking about the monoclonal antibodies and the various other treatments that are coming here, the oral treatments. I just wish that we had them here as we continue to go through this, because people are, you know, even though this is less severe with the Omicron, I get it, it's great that that's the way it's turning out. But we still have these people with underlying health conditions that it's still going to be severe for, and these are life-saving things that we just don't have enough of right now in this community, and I'm sure throughout the country right now. So that's hard to stomach a little bit. There was an article in the Chronicle a while back in middle of December. It says key COVID therapy going untapped, and it was all about monoclonal antibodies, and I think Alameda County was having posters up at their testing sites and handing out flyers, and it sounds like we're really getting towards that. You guys are doing all you can to try to get that information out there now, so I appreciate that. So good stuff there. And then the last thing, just again, thank you for all of this and all the work that you guys have done through this, and I appreciate if I've come across, or I apologize if I've come across upset, never at you guys, just upset in general over just how this has gone, but I'm glad we're getting to where we're getting. The last thing, really quickly, it was said, I think Julie, you said it, or I can't remember, Marianne, contact tracing no longer effective, just the way things are going. What are we doing as far as our contact tracing? I'm always thinking about the numbers, the dollars we're spending there. What's happening with that at this point?
Well, I'll start a little bit. As the incubation period shortens, the ability for contact tracing quarantine to be effective decreases, right? Because you're narrowing the window too much by the time someone has a positive test and you notify contacts. You know, they're either sick or not. So it makes it much more difficult to do. I think if you want to talk about what we as the county, so I referenced it in schools. If you want to talk about what we as the county public health are doing.
Rest assured that the staffing and funding that we have cannot keep up with 900 cases a day. And we're not trying to. I mean, it's not feasible or effective, right? So we really do. We really do, take a look and figure out what makes the most sense. So our efforts with our staffing is really concentrated on helping schools, school outbreaks, trying to keep kids in school, helping businesses. It's really a lot about outbreaks and trying to give guidance. There's for any positive PCR test that has a cell number that is not minors. There's a statewide system where that text information is going out. So whether or not we're making a phone call, individuals should, in almost all cases, get information that if they need to know where to ask questions, it should be reaching them. And if they call, certainly we're trying to trying to help them. But just your point is well taken, and know that we're trying the best we can to prioritize the resources where it will have the most value, knowing that we can't contact trace.
Perfect.
We can't do the case investigation for every individual.
That's perfect, yeah. So it sounds like we're being smart about it, and we're not throwing good money after bad. We're just redirecting resources to where we can get the biggest bang for our buck at this point.
Exactly.
Okay, all right, thank you guys very much. Any other questions, comments? All right, thank you guys very much for your presentation. Appreciate that. Okay, we will move on to public comment. This is a period of time for anyone from the public that would like to comment on any item that is not on the agenda. I've got some cards here, and also even if you didn't turn in a card, we will still let you come up here for 5 minutes. I've got a couple that are that were emails that we received. One from Take a Stand Stanislaus, and another one from Virginia Hammond. So those were two. We won't read these, but those were two that were sent in that are available for people to see. I guess would those be online if people wanted to see those? They're not. Okay, so we've got these if anybody wants to see the what came in. Okay, so we're going to start off with our first speaker card that I have here is for Stephen Morrow. Stephen, good morning. How are you?
I'm doing fine, Mr. Chairman, and Happy New Year to everybody.
Happy New Year to you.
All right, good. First, thank you, Mr. Chairman, Supervisors, Mr. Hayes, and Mr. Bose. First, congratulations to Chairman Withrow and Vice Chairman Condent on their selections, and thanks to Supervisor Kayello for his service as chairman last year. It was a tough year for everybody. The first point I wanted to address is about the first week of operations of the Stanislaus County Regional Transit Authority. The first week was a little bit bumpy, and we kind of expected that, but things are beginning to improve this week. But there are still some problems with the service. Real-time information is readily available for the former MAX routes, but not for the former START routes. So all of that stuff's eventually going to get worked out, and we'll say more about that at the board meeting, the transit board meeting at the end of the month. The major thing, though, is a group has put together a proposal for a new downtown ballpark. And there has been items about it written in the B. And while this group has clearly done a lot of time researching the proposal, we got to look carefully, really carefully, before we proceed. Much is going to be said about the proposed economic benefits for the area, but we also have to ask the folks of Alameda County who funded improvements for their facilities and then saw the two teams involved skip town and leave the taxpayers holding the bag for anywhere from $50 to $100 million in debt, which still has to be paid off. And of course, there's lawsuits pending on all of that, so that's still to be resolved. But that said, there's a lot in the plan that can work, but groups that promote these ideas need to stop using the county government and the Board of Supervisors as an ATM machine for $85 to $122 million ballparks. We can't print money like the federal government. We got to live within our means. And we have other issues that are far more important than a ballpark: our homelessness, housing, all of our roads that need repaired. And we need to look at that stuff first before we think about public financing of any ballparks. Now, that said, I still would support any zoning variance that would need to be passed to allow the ballpark to be built. But the people involved, they need to go raise the construction and operation money privately, just like the San Francisco Giants did for AT&T Park. They seem to be doing okay. And let's hope for a good year and hope that 2022 is better than last year. Mr. Chairman and Supervisors, thank you for the chance to speak today.
Thanks, Stephen. Okay, next up, we have Yvonne Reynolds. Yvonne, good morning. How are you?
Good morning. I'm good, thank you.
Good.
How are you all this morning?
Good, thank you.
Okay. I recently read an article by an F-Gate reporter who interviewed the Vice Mayor of Orville. In that interview, the Vice Mayor was able to clarify why they declared their city a constitutional republic. Mr. Thompson gave this answer. Yes, so I chose those words on purpose. Constitutional has a background behind it, which is what is in the United States Constitution and what it gives us. This document protects us from the government. The Founding Fathers came here because of the overreach and the way the government was run in Britain. They wanted freedom to worship, and those who fought in the Revolution wanted a voice in politics and fought against taxation without representation. The founding document of this country protects the rights of its citizens against the government and says there are certain self-evident, unalienable rights that are not given by the government and should be protected. The second word, republic, was chosen because it is what America is. We didn't declare ourselves a new country or a community or the Communist Party of China or something else. We declared ourselves what we already are. We are not a pure democracy, but a republic, which gives a voice to minority because otherwise you have majority rules. In a pure democracy, if 51% of people want to take away your house, they can take away your house. But in a constitutional republic, you have rights that no one can take away. Further in the interview, Mr. Thompson asked, "Where is the line between keeping each other safe and protecting freedom?" I think we have reached a point in this country where people elected to represent us do not understand the role they play in the government and their responsibility to listen to their constituents. We are all familiar with the phrase, follow the money. Our elected representatives are elected to represent we the people, not Dr. Fauci, not Governor Newsom, not the teachers union, not the FDA, not the CDC, not Pfizer, not Moderna, not Johnson & Johnson, not Facebook, not Twitter, not the fact checkers, and not the mainstream media. I believe we have reached a point in our society that we need to look at the importance of local control and policies. A one-size-fits-all approach does not work in a country as large as ours. A one-size-fits-all approach does not work in a state as large as ours. A one-size-fits-all approach does not work in a county as large as ours. Dictionary.com gives this definition for state of emergency: a situation of urgent need for help and relief brought about by natural disaster, such as terrorism or other crisis, especially as declared by a governor, president, mayor, or other official. Lexico.com gives this definition for a state of emergency: a situation of national danger or disaster in which a government suspends normal constitutional procedures in order to regain control. Based on these two definitions, I do not understand why we are still considered to be in a state of emergency. I believe it is time for our county to take steps necessary to end the state of emergency in our county. The longer this goes on, the more information is being released that proves that our country has made some huge mistakes in how they handled so much over the last 2 years. The CDC just announced that 75% of the COVID deaths were in people with at least 4 comorbidities. Many people have been talking about this for the past 2 years, but politicians and bureaucrats have refused to listen. So why no early treatment? Why no education about prevention? Why no education about healthy choices? An article in the Washington Examiner just a few days ago is advising that we take El Salvador's coronavirus advice. Their president shared a video last week about a new ad campaign to help prevent COVID-19 deaths and hospitalizations. The article states, for once, a campaign about a public health crisis focuses on health itself. Live a healthy lifestyle, eat a healthy diet, lose weight, get fresh air, exercise, get outside to improve your vitamin D levels, get vitamin C from fruits and juices, drink water to help kidneys, reduce stress, get a good number of hours of sleep, avoid alcohol, fatty, sugary foods. What a concept. I had more on here, but this is the word that I live by, and this is the document of our country. Thank you.
Thank you, Imam. Thank you very much. Okay, we'll move on to Janet. Sorry, I don't have your last name there, Janet. Just
It's Betcher.
I'm sorry.
Betcher.
Betcher.
Like Fletcher.
Very good. How are you?
I'm well, thank you.
Good.
And it's a real privilege to be here. This is my first supervisors meeting that I've attended, and I wish you all a happy new year.
Thank you.
I didn't come in with any planned words to speak, but I knew I would want to respond to what I've heard today. And that starts with the invocation by Imam Kayello. I thought his words were terribly important and very meaningful right now. The idea of being tolerant and patient. This has been a hell of a last couple of years for, particularly for teachers. I'm a retired, newly retired teacher, and for parents of small children, and for everyone really, and certainly for our first responders. A very stressful time, and wherever possible, I pray that we give each other grace and allow a sense of tolerance and certainly patience. I have to say, I'm very impressed at the comments of CEO Hayes. I appreciate your remarks deeply. And I was totally impressed with our health services team here and the work they've clearly put in. And goodness, they must be really stressed out too. But anyway, I just came here to witness our local government, as remarked upon, in action. And I have to say, I'm greatly heartened, and I thank you all for your work. And it's good to see those who came to witness this. It's good to see you all here today too. Thank you.
Thank you, Janet. Come back.
Oh, I will.
Thank you. Okay, next up I have Joni. I'm sorry, Joni, I should know that. Good morning, and how are you?
Good morning, thank you. I'm well. Happy New Year.
Happy New Year.
It's Greep.
Greep, I'm
Greep.
sorry, I know that.
That's okay. All right, as I have consistently spoken on behalf of my kids in front of you guys, I'm doing it again on behalf of all of the kids in our county. They are our future, and I will continue to argue that they're your most important constituents. I'll hold that opinion forever. Just a few reminders. California was the last state in the nation to reopen their public schools. And it is the first state and the only state at this point that is enforcing a mandate for COVID vaccination for students to remain in the classroom. Dr. V herself just stated that she is looking for trends in a disconnect between cases and severe disease. There has always been a disconnect between cases and severe disease for our children. From the beginning until now, that has not changed. But we still have state guidelines, mandates, and local policies that seemingly do not take that into account. That is crazy. That blows my mind. I stood before you all in July begging for your help to advocate against the state forcing young children to have to wear masks at school. I said it feels like the state is waging psychological warfare on our kids. I had no idea at that time that masks would be trumped by the state's impending mandate to force vaccines on our kids in order to receive an in-person education. And there is still no plan, none, to get masks off of our children. So I want to share with you an email. I email a lot of people all the time. I'm always advocating for my kids, but I recently emailed Dr. V, and she had someone in public health, Mrs. Thrasher, respond to me, and I was addressing some of these concerns and questions, and I always get deflections, and we just have to follow CDPH guidance. We're just following the guidance. That's all we can do. Is just follow the guidance. So anyways, I wanted to share with you my response to her as she was just deflecting and well, this is CDPH guidance, you know, our goal is to keep schools open. So this is what I responded to her by saying, my son was 11 when his world was flipped upside down. His school was closed for an entire year and 3 seasons of sports activities robbed from him. He still struggles. He was 11. He was like this tall. Now he's this tall and he's shaving. Crazy. I appreciate the goal of public health to keep schools open, but I cannot communicate this clearly enough. Your policies are hurting our children. The policies that are intended to keep our schools open are doing more harm than any measurable good. It is incredibly difficult to take that slideshow, and she sent me a slideshow from the CDPH that justified all of the policies and guidelines of the CDPH. It's incredibly difficult to take that slideshow presentation seriously when it quotes a judge from Dallas, Texas in August stating, quote, "In Dallas, we have 0 ICU beds left for children," Clay Jenkins, Dallas County judge, said during an August 13th news interview. "That means if your child is in a car wreck, if your child has a congenital heart defect or something and needs an ICU bed, or more likely if they have COVID-19 and need an ICU bed, we don't have one. Your child will have to wait for another child to die." Are you serious? This is what the CDPH is using to support their guidelines? A quote that your injured or sick child must wait for another child to die to receive help? Because in August, Dallas, Texas PICUs were full, and what were those PICU beds filled with in August? An onslaught of COVID-infected children in August in Texas? No. As a registered nurse, I'm not only offended by this outright lie, I am horrified by the use of fear-mongering and the justification for continued harmful policies on our kids by our CDPH. Dirty cloth masks are on our children for 8 hours a day in this state, and now we are being told that as soon as the FDA approves them, the vaccines are a mandate for children to remain in their schools, all in the name of keeping schools open. It's the only way, according to our state. I have seen the negative effects of these policies on our children with my own eyes, with my own son. I will not stop advocating for what is right. I will not stop speaking out on behalf of my son. The European Centers for Disease Control and World Health Organization does not even recommend masking for children under 12. And my time's going to be up soon, and I could go on and on and on, but I think you guys get my point. We got to end the state of emergency in our state and in our local community for our kids. We have to. Thanks.
Thanks, Joy. Okay, that's the last speaker card that I have. Is there anybody else who would like to speak? Come on up. Good morning.
Good morning. My name is Ashley Miguel. Joni sounds very sweet when she speaks, even when it's passionate to her, and I hope that I sound the same. So I don't have a lot to say, but I think education in our community is a huge problem. We are seeing record highs in the emergency department. Last night was a record high. They are not all COVID patients, but yes, COVID is definitely straining us. With that being said, we will never turn anyone away, but we need to educate the community. So I don't know how many people watch this online, but I'm hoping a lot, because people are coming in that are asymptomatic, that were just exposed yesterday. It is very unlikely that if someone is exposed yesterday, that they will test positive today. So we are swabbing these people when we're already in a shortage, and the test is going to likely be inaccurate because you will not test positive today. So if you test today and your results are negative, that does not mean that you are negative. So I hope that this gets out to the community so that they know. I'm not saying that we shouldn't be testing people. I'm just saying that it's an education problem, that we should not be testing anyone and everyone when we're already in a shortage and you were just exposed an hour ago. I also want to say that I'm not sure exactly when primary care doctors stop seeing patients. They're being sent to respiratory clinics, which are also overwhelmed. We are strained in the emergency department because of nonsense like this. I'm not exactly sure why it's okay for me to wear an N95 and test people, but people cannot be seen in a doctor's office and be swabbed for COVID. Everyone should be able to see these patients and swab them to take the strain off of your healthcare system. I also know that we're not trying to put blame on anybody in this room, but if you have the ability to get information on life-saving treatment out to the community, but you're not because of constant change, that, in my opinion, is a crime. We should be getting this life-saving information out to people, and I know no one doing that harder than the ladies that are sitting behind me right now. And they're doing that on their own time and their own dime. So I'm not saying that we should put blame on anybody, because I know that We're all working as hard as we can. However, I do think that more can be done that is not being done. So that's all I have to say. Thank you.
Thanks, Ashley. Corinne.
Hello.
How are you?
Good. How are you guys?
Very good.
Corinne Whitlow for the record. I do have an extra copy of a Constitution if anybody has any questions about how these things go. I've bought lots of them. I've spread them out. I've been reading them myself to kind of try to understand really kind of what's going on here, and it doesn't make sense, but that's kind of besides the point. Merry Christmas and Happy New Year. Actually, I'm really looking forward to this year and seeing kind of what happens. I was very happy to hear Mr. Jody Hayes talk about a new phase we have going on here. I do believe we are experiencing a new level of Jumanji, and I just hope it's one that we are going to be as well. My only concern is I still haven't heard anybody talk about our mental health crisis on our children. I keep wondering when that's going to kind of be brought back into the presentation of COVID or the talks within COVID, because I do think it's not a coincidence that our children started this year in a national emergency regarding their mental health. So I'm kind of waiting for that to play a part here. I also liked the part about talking about biased information. I was always taught there's 3 sides to a story. One person's, the other person's, and then the truth. I think Mr. Jody Hayes kind of refers to that. We have data, we have social media, but then we also have what's really going on, right? And that's kind of why we all started coming back in August, to kind of give you that insight as to what's really going on in your community. To be honest, I don't care what's going on in this whole state of California. I don't care what's going on in the whole country and really in the world. I got to focus on my family, my tribe, and my community. And so that's what I think it's really important that we are paying attention to what's going on here at a local level. When I first came back in August, I had just a couple points. I really didn't know what I was doing. I just knew I was really upset. My first point was science is ever changing. And I think we're seeing that now. Unfortunately, I think we've waited too long to acknowledge that, and we've harmed many, many people, especially our children, in the time. I asked that we don't forget our fundamentals. We've also done that. We have a state of emergency where people who are part of public health just make all the decisions. We don't go through the normal processes, which leads us to not even know what's going on in our own community. How can we track if what we're doing is being effective and if that's what we need to continue to do if we're not part of the problem solving? I hope in this phase 3, I think we called it, we can transition from our reactionary processes. We do all the time, right? Here it comes, we're on the rise, everybody throw a mask on, let's do this. You know, we're going to change testing, we're going to change this. We keep reacting every time, but we've been doing this for so long. We should have long-term solutions in place. We had them with the flu before this, and we're living with it. So I hope within this phase we can get out of those reactionary phases and get to long-term solutions which are not ran by the government. And then also just taking care of people, right? We're talking about these numbers, these hospitalizations, everybody becomes a patient in my mind, right? But when people become patients, you lose that human factor and you lose your purpose completely. And that's what we're here to do, is to really connect people and to take care of our people. The deaths that we've had in our county, I think it's because we put all of our eggs in one basket. We really were hoping that this vaccine was going to help us. I was looking back at the presentation from March 16th of 2021, which was the COVID update, and page 36 literally states that the vaccines are 100% effective. 75% effective to prevent death and 100% effective. 75% for severe disease and 100% for death. Now we have an update, we're more like 30%. So that science is ever changing stands more true now than ever. We got to stop focusing on just one thing and really look at and use every tool we have. The lack of the early treatment focus has been our biggest concern. We've been talking about that. Dr. V hopefully looked at her magical ball and said, and we can anticipate our peak to be a week or 2, so now is the time. We have to provide these early treatments now, or our community is going to suffer, and people are going to die. Our hospitals are going to suffer, which kind of brings me to a lack of focus on our healthcare system. Our bed capacity is worse now than it ever was. Worse than the beginning of COVID, worse than the middle of any wave, we literally are allowing COVID positive symptomatic healthcare workers to work. So my question is if, and it says within the newsletter, there's different guidelines for healthcare workers. If I'm allowed to come to work symptomatic and COVID positive, do I get to continue to live my life in society? So maybe public health can answer that for me. I do think it's time that we change from, in one of the CDPH orders, it did say that this is guidance. Local public health can make, essentially, they make the orders for their own community. I believe it's not my job, this is your guys' job. I think at a local level we could do better. Thank you.
Thanks, Corinne. Okay, next up, come on up. Good morning, how are you?
I'm great, thank you. First of all, officially, I want to say, Mr. Manny Grinnell, thank you for that. Him and I don't see eye to eye on things, but I want to give him a lot of credit. He helped me with the situation. He was on it, and it was taken care of. So thank you so much officially for doing that. So there is some hope.
I'm sorry, can I enter just your name, please?
Janet Roach, I'm sorry.
Perfect, thank you.
Hi, Mr. Chan. So in regards to the nurses behind me and the speaker behind me, I think the Constitution should be given to them, because I think you guys are really, you guys understand it more than anybody. I wanted to read something actually that I read this morning. It was an article on the CBS San Francisco Bay Area. It does say, according to the California Department of Public Health, California health officials allowing infected hospital staff who are asymptomatic to stay on the job. So what does that mean? We went through this whole transition where they violated constitutional rights to many health officials to get terminated or not come to work because they refused to get the jab. The jab that we already know does not work because even AOC is infected with it. So now we got all these super spreaders with the jab on who are probably going around town and even in hospitals infecting other people. We all have different bodies. We're going to have these public officials or these workers at hospitals that are asymptomatic, but my grandma could be in the hospital for a whole complete different reason. Now she could very well get sick and possibly die. This is stuff that she's not even willing to open about. That's a Pandora box nobody really wants to discuss. My point that I want to bring out is that we really need to end this. Like you said, it's here to stay. We're going to take preventative measures. Let's not close our gyms. Let's not do it. We don't talk about that. I myself need to lose some weight. The nurse, the doctor behind me needs to lose some weight too. Let's talk about that. Let's talk about nutrition. And I'm going to tell you why all these little other medications that are probably beneficial for us as a preventative, why they don't, because it's really about the money. I have stocks in Pfizer. Thanks to the sheep, I'm making some money out of it. So this is the only reason why the government won't, because Pfizer they work together on this. You'll never see that. I wish they did, and I'm actually, thank you, because I'm looking into that stock when I was sitting down. But it's probably not a good idea because the government's not going to pick it up anytime soon. But that's why. And I think you gentlemen, when you guys really get together, please listen to the community, because people do want to be heard. They're just intimidated by people like them. Thank you.
Thank you, Janet. Anybody else? Okay, come on up. Good morning, how are you?
Good morning.
If you could
Very
state.
well, thank you. Hi, my name is Maritza Romero, and I thank all of you for being here, all those present.
Maritza, pull that mic up a little closer to you so we can, perfect. Thank you.
Okay, sure, thank you. So, my biggest concern, as one of the nurses said, is our youngest, our most vulnerable that we need to protect. If we don't come to the protection of our most vulnerable, then what's to say we're going to protect anything else, I have a daughter that's at Johansson High School. I have 8 children, but right now my biggest concern are these mandates that are supposed to be, enforced for vaccinating. And I cannot imagine the heart of my little social butterfly being broken when I tell her she can't go to school anymore, if that is mandated for her protection and the protection of all children. I so hope that our county can break away, from the thumb of the tyrannical mandate of our state for our children. And I would like to share this, and this is an article from Dr. Robert Malone, who is like a chief, he's an expert in mRNA. He's the one who helped to bring the technology to us. So he states, when it comes to, and this is peer-reviewed, and I will, at the end, say where the information was also gathered. So he says, for children that are vaccinated, a viral gene will be injected in your children's cells that forces your child's body to make toxic spike proteins. These proteins often cause permanent damage in children's critical organs, including their brain and nervous system, their heart and blood vessels, including blood clots, their reproductive system. And this vaccine can trigger fundamental changes to their immune systems. Children risk severe adverse events from receiving the vaccine. Permanent physical damage to the brain, heart, immune, and I'm sorry, I'm repeating myself. Healthy and vaccinated children are critical to achieving herd immunity. Natural immunity is proven to tolerate infection, benefiting community protection, while there are insufficient data to assess whether COVID-19 vaccines assist herd immunity. My daughter told me, because I too am not immunized, she said, with people like you, we will never reach herd immunity. And I told her, well, you never will, even if everybody was vaccinated, because even people that are vaccinated can contract COVID. So there's so much misinformation that really breaks my heart, because children are the least likely to contract it and are the ones that recover the fastest. And even though right now, yes, it's more transmittable, I mean, still they're like bouncing back and recovering. The children that die, unfortunately, are those that are just like with the elderly and all other people that are, most susceptible. But anyway, this data collection and analysis has been prompted by an inquiry by the Thomson Reuters fact-checking organization, which was sent to Drs. Robert Malone, MD, on the 28th of December 2021. And I've read a lot on this doctor, but I really think that it's a crime that we're being told what it can do and how, the harm that it can do and whatever when it comes to just contracting it. But thank you. I'll close with this. Why don't I see the VAERS on TV all day? Some people don't even know that VAERS exist. Why isn't that stuff being, shared and expressed on the news and on everything else, on whatever? The newspaper, schools, doctors' offices, so that we know and can make an informed decision on how to better protect our children, our most vulnerable, beautiful members of society, our future. So thank you again.
Thanks, Marissa. Thank you for coming in. Okay, anybody else? Emerson. Emerson, good morning. How are you?
Don't start yet. Good morning. Congratulations, Mr. Chairman.
Thank you.
Supervisors, ladies and gentlemen. You know, it's interesting. If I walked through the door right now, I'd have a flashback. I'd say, wait a minute. I didn't go to the Turlock Board of Education, let me get it out right, where we have somebody not willing to wear a mask. When I walked through upstairs, they said, I was wearing one, but they told the person in front of me, got to wear a mask. Oh, I have a medical exemption. We seem to have a lot of medical exemptions in the room, people. And this is one of the reasons we've got a problem in this country, and especially in Stanislaus County. Just the other day, there's a letter to the editor. The guy goes to the gallows, you got to wear a mask. Okay, the minute he gets in and sits down, people all around him are taking them off. Well, I got to tell you, if you're going to be cheering in an enclosed space, you're going to want to wear a mask. When I hear somebody tell me about the mental health of our children. So basically what you're telling me is by exposing them more hours of the day to their parents, it's a detriment. Because that's what you're saying. Now, I've participated. Two of the youngest members of our family are doing this, you know, through the Zoom, if you will, going to school. And it's not easy. We've got the classes. We have to sit down later on and make sure they understand what's going on. Make sure they fill out all their lesson plans, because it's easier just to drop them off at school, pick them up at 5 o'clock. School takes care of it, no big deal. It's 3, but every school has one of those babysitting programs is what it amounts to. You know, the one number that keeps jumping out to me is that 92% of the deaths from COVID in this country are the unvaccinated. So 9 out of 10 people that die is because they didn't want to take the jab. I'm sorry. I know I shouldn't be mean like that and talk that way, but it gets ridiculous. We hear the same thing over and over. Somebody's showing you the Constitution. First of all, it's amusing to me that they're almost always unbent. Tells me they haven't been read. Most of us had those classes when we were in high school. We know what it says. And for those that think that the people came to this country so they could celebrate their religious freedoms because they were oppressed, the exact opposite is true. They came here so they could have stronger laws insisting that people follow their particular religion. We all know the state of Virginia imposed a law that said you had to not only join the Church of England, but you had to go on Sunday. Now, this is all before the Constitution, so let's understand. Some of the things we've been told in the past aren't necessarily true. But I have to tell you, when I go into a business and I see the people inside there ignoring the mask rules, I don't sit down. I won't go to the gala because they refuse to enforce it. I think that's important because you never know if you get it who you're going to pass it off to. Somebody that hasn't had the vaccinations and the booster? Those that probably will not die? No, let's find some reason not to. Well, the very youngest in our family have had the vaccinations. The booster, the youngest one just turned, so she's not going to be eligible for it for a few months yet. But we try to make sure they had their 3-in-1 shots. They had all the rest of the vaccinations. But everybody's got some excuse. You know, it started out what appeared to be a political movement or an argument. Oh, we can't believe that. So now we don't believe anything. And yet so many people are getting their information from what, OLN? Breitbart? I mean, you can argue about the mainstream media being biased. You can talk about them, but SOB to an extent the same way. But if they give you the unadulterated facts, that 9 out of 10 people that are dying from COVID in this country are unvaccinated, I don't see where you go from there. And the fact that these people will particularly come down here and refuse to wear a mask and take a chance on passing it to somebody else, because it's real communicable. Even if you'll wear a mask, you can get it, of course. Doesn't prevent you from catching the disease. It helps you not to die, but that doesn't, because that's other people. We've got to protect our kids. You always hear, thousands are dying from the vaccinations. I have yet to find that to be true. I can't find any substance, anything that shows that that's an accurate statement. But you keep hearing it over and over. Just like these little coffee klatch groups that all run together, cheer! I'm sorry. And they expect you to pay attention? You know, you should take care of the majority of people. You know, we protect our businesses so much right now. You don't want to tell us where business is having the outbreaks. You don't want to tell us where the outbreaks are. But let's worry about businesses keeping going forward because they want our money. Protect everybody. Wear the mask. Don't like to cuss. Don't like to do that. Wear the mask. Help the next person out. Be concerned about your fellow man. Don't tell me about your rights. Worry about their ability to breathe and live. Sorry about the overtime. Again, congratulations. Thank you very much. No, this goes back. Now, let's just say I thought Jim DiMartini was behind the wall a couple weeks ago and we were dealing with an episode of Reefer Madness. Have a nice day.
Okay, thanks, Emerson. Okay. Jody, real quick, Jody.
Sorry, I know I took my 5 minutes, but I just wanted to just be very clear that freedom of speech is so important and a beautiful thing in our nation. So I would fight for anyone's freedom of speech, and I just wanted to remind the board that discrimination is ugly in any form. Discriminating against anyone for anything is ugly, and I hope that our board takes that seriously and takes that into consideration as all the policies, continue and the science changes and the guidelines from CDPH come forward. Just discrimination is never good for our community, so I hope that you guys just take that to heart. Thanks.
Thank you. Okay, anybody else? Seeing none, we will close the public comment. Thank you all for your comments. Okay, we're going to move on to our consent calendar. Is there any item on the consent that anybody would like to pull from the board? Anybody in the audience like to pull any item on consent? Seeing none, I'll look for a motion.
Motion to approve all consent items.
Second.
We have a motion and a second. All in favor? Aye. Opposed? Passed unanimously. Very good. Thank you. We have no public hearings, no discussion items. Correspondence.
This board has received a copy of the Community Services Agency Fiscal Year 2020-2021 Annual Audit of the Child Care and Development Alternative Payment Program Stage 2 and 3 contracts.
Acknowledge receipt of report.
This board has received a letter from Reclamation District 2063 regarding the resignation of Rural Butch Watkins and the appointment of Michael Brazil to their board of directors.
Acknowledge receipt of the letter.
This board has received a letter from the Riverdale Park Tract Community Services District regarding chemicals in their water system exceeding the notification levels.
Refer to the Department of Environmental Resources.
This board has received a letter from the Houston Fire Protection District regarding the resignation of Randy Sullivan and the appointment of Mark Hughes to their board of directors.
Acknowledge receipt of letter.
And this board has received the claims as noted on the agenda.
Acknowledge receipt of the claims and refer to the chief executive offices. Any board of supervisor reports?
Happy New Year.
None. Happy New Year, everyone. Thank you. Okay, legislative fiscal and management reports. CEO Hayes.
I do have a report this morning, and I want to start by recognizing and acknowledging Dan Rosas, who has been a longtime member of our countywide leadership team at the Community Services Agency, and he is pinch hitting for us, helping out with PIO and legislative responsibilities in the Chief Executive Office as we celebrated our former legislative director, Amy Carroll, and her new ventures with another organization. So thank you, Dan, for supporting this effort, and I want to provide to you a quick, short update on the governor's proposed budget that was released yesterday. I think everyone is familiar that the governor releases a proposed budget in January of each year. That budget is then considered through the legislature, and typically there's a May revision, and then at some point we actually have a state budget. So what the governor releases in January can really change quite a bit until the final version is adopted. However, it does basically outline the priorities for spending in California from the governor's perspective. So I'll just share with you some of those major points, and apologies if I miss any of them because there were a lot of items. There's at least a $31 billion surplus identified at the state level. I can't really speak to how much of that is ongoing versus one time, but it is significant, and clearly there are lots of competing interests on where to prioritize fiscal resources in California. First is the governor identified 2.7 additional billion on the state's COVID emergency response. That includes testing, medical personnel, vaccines, all the things that you would expect related to COVID-19, many of which we've talked about here today. Quite a bit of investment in what is referred to in the category of climate change, but of interest is about $650 million to support firefighters and infrastructure, along with $1.2 billion for forest management and other practices. Not a lot of that applies here in Stanislaus County. However, it is certainly an interest of statewide concern. An additional $750 million for drought response for residents, farmers, and wildlife. We're very much interested in what the details of that are. You may recall that there was over $5 billion established for last year's water package. So there's a lot of money we're talking about here, but what really matters is how does that influence us here in Stanislaus County. There is money set aside, particularly for those counties that rely on fossil fuels. So a lot of money there to try to convert those counties into areas of clean energy and so forth. Homelessness. So we had a $12 billion homelessness package last year. This year, the governor's recommending $2 billion additional for housing and services, including encampments. We've yet to see a significant movement on the prior resources, so curious to see exactly how these new resources might be deployed. There was an area that is generally referred to as cost of living, but some of the categories under that area include the state being the first in the country to provide health care coverage to undocumented immigrants by January of 2024, so that is a legislative funding priority for the governor. Expansion of mental health services, including $1.5 billion for spending on mental health resources for school children, and $4.2 billion for new funding of high-speed rail, additional new funding in the Central Valley. Some of you may have already heard about how that might impact us locally, but I haven't received any of that information, so I really can't say. There is money here, additional money for local law enforcement, particularly around what is commonly referred to as smash and grab crimes. There's interesting, I guess, emphasis on prosecutions at certain levels and whether or not investigations and prosecutions are conducted at the state or locally through district attorneys. There's quite a bit of disagreement going on right now about what these property crimes mean to the community, and I don't just mean property crimes, but a lot of these crimes that generally fall under the category of the prior Prop 47 legislation. And I think that's where I'm going to wrap it up. There's a lot of other stuff there. You'll all receive written summaries of this information with more information, but generally those were the big categories highlighted by the governor in the release yesterday. And as always, we will keep you informed as the conversation progresses. Thank you.
Very good. Thanks, Jody. Vito, you had something?
Yes, I'm so sorry. When Emerson had talked about Supervisor DeMartini, it reminded me about the animal shelter because he was such an advocate. And the month of January is always a difficult time to get animals adopted out of there. People just don't think about getting an animal until kids are out of school. So there, for the whole month of January, any dog that's over 60 pounds is only $22. Cats over, I think it was 10 pounds, is something similar. So I just want to remind people, because we don't bring that to the forefront, except for once a year when we get the report, the animal shelter has plenty of animals, dogs and cats, to be adopted. So please consider it.
Very good. Thank you. Okay, before we go to closed session, Tom, adjourn. I'll let you.
Yes, we have closed session this morning. We have a conference, one item, conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9, Subdivision D1. We have two cases, Angelina Nunez and Emmanuel Alves et al. Versus County of Stanislaus et al. In the U.S. District Court, Eastern District. That's case number 117CV00633. And Angelina Nunez and Emmanuel Alves, DX and LX versus Carrie Stevens et al., U.S. District Court, Eastern District. Case number is 119CV00204. And with that, we are appropriate for public comment on the
Any public
closed
comment
session.
on the closed session? Okay, seeing none, two quick things, just again, recognize and congratulate Tina Rocha on her, I think Tina's left, on her promotion to Assistant Executive Officer. Thank you, Deputy Austin Davis, I think it's your first meeting, thank you for being here with us today, and thank all of you guys for staying here throughout the whole meeting. This meeting's adjourned.